My name is Stacy McAllister. On behalf of the University of Pittsburgh's Alzheimer's Disease Research Center and the UPMC Department of Neurology, I am pleased to welcome our presenter, Dr. Oscar Lopez. In this video, Dr. Lopez will provide an update on how patient care is being approached at UPMC during COVID-19, as well as the current state of clinical research at the Alzheimer's Disease Research Center. Additionally, Dr. Lopez will share how patients with cognitive deficits and their caregivers can cope during these challenging times. Dr. Lopez, Professor of Neurology and Psychiatry at the University of Pittsburgh, holds the Leventhal and Pittsburgh Foundation Endowed Chair in Alzheimer's disease and related dementias. He is also the director of the University of Pittsburgh's Alzheimer's Disease Research, commonly known as the ADRC. He is a world-renowned researcher and physician. You can learn more about Dr. Lopez, his research, and the ADRC by visiting their website, www.adrc.pitt.edu. At this time, I am pleased to welcome Dr. Lopez, whom so many of you have known for so many years. Take it away, Dr. Lopez.
Thank you, Stacy, for your introduction. And I think that you're right when you say that we're living through very unusual circumstances. And I believe that every human being in the planet is being affected by the COVID-19. And I would like to share with you how we are dealing from the research, in the research environment with the infection, and how are we dealing with the patients in our clinics. And I would like to give some recommendations for the caregivers about how to deal with patients during the COVID-19 pandemic. As you know, one of the most important risk factors for bad outcomes with the virus is age. And in addition, there are many publications now that are showing that cardiovascular disease and hypertension, in conjunction with age, create the perfect storm for morbidity and mortality with the infection. So our patients, especially those with Alzheimer's disease, are at increased risk of bad outcomes with the infection. So what we are doing to prevent the infection is extremely important, and the best way to prevent the COVID-19 infection is to avoid being exposed. The virus spreads from person to person and can be spread by those individuals who are infected but do not display symptoms. The primary goals of using mitigation strategies, like we are doing here in Pittsburgh, we call it shelter in place, are to slow the transmission of the infection, to protect individuals at risk, healthcare workers, and the society as a whole. But all this has an effect on clinical research and practice. What is happening at the ADRC? The ADRC is a research center, and we are doing practically what all the academic centers in the country are doing. We suspended face-to-face contacts and imaging studies with our patients. However, we continue with telephone contacts with patients and caregivers. We are doing questionnaires. We are trying to obtain as much information as we can through the phone. Our social workers and clinicians are available to answer questions. And what is very important, the ADRC is offering a virtual caregiver support group that are providing updates and tips for families on our website and social media. As you know, the majority of the Alzheimer's centers in the country are doing drug trials with anti-amyloid therapies and treatments for many types of dementia, but especially for Alzheimer's disease. All the face-to-face evaluations and imaging studies have been suspended. The same thing with the patients that are coming through the ADRC, and those that are enrolled in drug trials are being contacted by phone, and we're trying to obtain as much information as we can. The infusions for anti-amyloid treatments have been suspended. As you know, the majority of the treatments that are focusing on amyloid in the brain are being administered in a way of an infusion. So all those treatments have been suspended. In those patients that are taking pills, we are trying to send pills at home and keep the patients on the trial without any interruption. And blood tests are done at home. But we are trying to keep the trials as active as we can, but those that require infusions or more aggressive intervention, they have been suspended. What we are doing in the clinic, these are the patients that are not research individuals. These are the patients that we follow in our traditional clinic. We are trying to avoid face-to-face evaluations. We are scheduling visits by phone, FaceTime, or through the UPMC telemedicine system. We are in close contact with patients and caregivers, and we can order emergency blood tests and imaging studies if it's necessary. And again, the neurologists in our department are available to answer questions from patients and caregivers. So what are the effects of mitigation measures for the COVID-19 infection? This is causing significant emotional and physical health problems, and our patients and caregivers are at risk. Physical distancing and social isolation may take a heavy toll on elderly individuals with cognitive deficits and on their caregivers. What's very important is that patients with dementia, especially those with moderate to severe cognitive deficits, they have difficulties understanding the COVID-19 pandemic. They are having difficulties understanding the meaning of shelter in place and adapting to changes in their activities at home, and especially with the fact that they cannot go out. Social isolation may exacerbate symptoms of depression and anxiety in patients with dementia. These are individuals that they already have depressive symptomatology and anxiety. Those symptoms may get worse. Or the isolation may trigger depression, agitation, insomnia, and disruptive behaviors. Patients can be more aggressive when they are dealing with their loved ones. The lack of exercise due to isolation at home may lead to deconditioning with subsequent muscle weakness and falls. And the decreased cognitive stimulation associated with socializing and engaging with the community may worsen cognitive and psychiatric symptoms of dementia. Just the simple fact of stop talking to the neighbor or stop going to the supermarket with the patient can engage in some social activity, those things can affect our patients, and they can make the symptoms of isolation worse. Regarding what I mentioned before, that patients are having difficulties understanding the COVID-19 pandemic, we have to explain what's going on in simple words. But if the patient does not understand, do not insist. Try not to confuse them. If they are happy where they are, don't try not to alarm the patients with comments about the COVID-19 pandemic. What is important is to explain in simple words why the person should remain at home. Try to make the patient feel safe and secure. And keep contact with other family members using the phone or other virtual methods. Sometimes the patients would like to go and visit a brother or a sister, And then you need to explain them that they cannot go to visit loved ones, but you can communicate with them through the phone. You can use FaceTime, Skype, all the other methods that we have that technology now is providing us. We have to use them because that is very important to calm down anxiety in our patients. In terms of activities of daily living, now that caregivers start spending more time with the patients, and some things that they were not paying attention before, they are starting to pay attention. And what is very important is do not get mad if the patient asks the same question multiple times during the day. That's very common in patients with Alzheimer's disease. You have to answer the same question every time that the patient asks. Make easy for the patient to find items that they forgot where they are. That's maybe they don't know where they put the purse. Make sure, help them to find it. Try to make life easier for the patients. Try to keep a very well-structured routine. Maintain a fixed schedule for breakfast, lunch, and dinner. Encourage the patients with dementia to help with household chores, listen to music, watch old movies, or participate in board games. But it's very important to keep the patients engaged. Even with simple things, we are helping a lot. Stimulate exercises. Even simple movements are useful. Patients are not walking now, so simple activities at home, just walking at home is just important. Going up and down the stairs, that is important. Maintain a fixed time to go to bed. Avoid using the bedroom during the day, and stimulate a healthy diet. Patients will try to eat more sweet things when they are at home. So try to replace the bad sweets, the bad sweets for good sweets. So you can replace chocolate cake for an apple or a banana. Psychiatric symptoms are common in patients with Alzheimer's disease and other dementias, and they may get worse during the lockdown. So it's very typical to see a lack of motivation and apathy in our patients, and this may get worse during the lockdown. It's very important to avoid watching TV programs with content that may disturb the patient. It doesn't mean that even if the programs about the COVID-19 pandemic are disturbing, there are some other programs that may disturb the patient, and usually you will know that this or that program may cause some anxiety. So you try to avoid the patients watching those programs. Let the person you care for know that it's normal to feel anxiety and sadness. If you are watching TV with them and they feel some anxiety and they feel sad about what's going on, in those who can engage with following current events, you need to let them know that you are feeling also bad about what's happening, and it's normal to react in that way at this time. Keep a good sleeping hygiene and avoid long naps. 30-minute naps is okay, but long naps are not okay, because what you want is the patient to go to bed at a good time at night. Some patients will become aggressive and agitated, so try to use distractions, photo albums, and talk about positive experiences with loved ones, and try to identify the triggers of those behaviors, so then you can avoid them. And it's very common in patients with dementia, the presence of delusions and hallucinations. And sometimes they are very mild. They don't create any anxiety or agitation, and you may be able to live with those symptoms. But sometimes they may trigger some agitation, and that will require a consult with a treating physician and possibly the use of psychotropics. But we will try to avoid the use of this type of medications during the lockdown. So it's better to use every strategy available to avoid the use of medications, but in some patients, we may have to use them. Caregivers are living with the patient are under significant stress, and especially, as I mentioned before, those that they are not all the time with the patient, and now they have to live 24 hours with the patient. That creates significant stress. And what is important is some people will tend to ignore the proper treatment of their own health problems. So people will forget to take medication for hypertension. They may skip medications for heart problems for 2 or 3 days because they are concerned about the patient with dementia. So it's very, very important to follow a routine and have a fixed routine, especially with medications. The feelings of loneliness and social isolation can make caregivers vulnerable to acute health problems. People can have a myocardial infarction. So some things that are that can disrupt the health of the caregivers may happen. So it's very, very important for the caregiver to pay attention to their own treatments and their own health problems. Those that are taking full responsibility of the patient's care may require additional physical and emotional efforts, especially when in-home supportive services are interrupted. So these are people that they go to work in the morning and they have somebody to stay with the patient during the day, and then they come back at night after work and they continue taking care of the patient. So now these caregivers, they have to be with the patient the whole day. And that requires additional physical and emotional efforts. For example, if the person who was coming to take care of the patient was changing diapers, now the caregiver has to change diapers. That requires more physical efforts. It's important to coordinate help with other family members. If something happens, you need to have sort of a network that you can reach and bring help to the patient. There is nothing wrong using relaxation techniques, seeking emotional support through friends and family members. That's very important. You need to at least call your friends and families and sort of telling what's going on and make sure that you have that those phone calls are make you feel that you have support for what you're doing. It's very important to have contact with your PCP. Your doctor needs to know what's going on with your patient and what's going on with you. And the other thing that you need to take into account is that you have to have a plan in case that the caregiver or the patient develops symptoms of infection. So we are moving now into a new world. We don't know how our society is going to emerge after the COVID-19 pandemic. And it will be particularly challenging for patients with cognitive deficits. Simple things we have to be reminded to our patients. For example, increased frequency of washing hands. Our patients may forget to that. So those simple things are going to make life with our patients more complex. The concept of social distancing, same thing. So some patients, they like to talk very close to others, so that it won't happen again. We have to keep the house clean, make sure that we are disinfecting surfaces. Those things are going to make things more complex for the patients, and especially those with chronic medical conditions. We have to take extra precautions. The use of protective gear like masks. We may have to use masks for some time now. So our patients will have to be reminded reminded that they have to use masks. And that is going to be a challenge. And we have to go into a sort of more technological world where more virtual visits with physicians are going to happen. So some family members may be very reluctant to take the patient with dementia to the doctor or for a blood test because they are afraid that they may get the virus. So virtual visits are going to be very, very common. And I think that's going to be challenging for patients with cognitive deficits, especially for the caregivers, how to deal with a new world that is approaching and is approaching very fast. Just a final comment. We have some local resources available at the ADRC. As I mentioned before, we have a virtual caregiver support group the last Tuesday of the month. We have lectures for researchers. We are in contact with the families of our patients. And you can also find, there are multiple ways of finding support. The Alzheimer Association has a website. There are many, many sources of support in the web that you can use. All of them are there just to help caregivers and patients. But we have something local that can be used. I think I'm going to conclude with this, and thank you very much, Stacy.
Thank you, Dr. Lopez, for such an informative and thoughtful presentation. I would like to move to a short Q&A session by asking you some of the most common non-clinical questions we've been receiving. Is that okay?
Yes.
Okay. So first, we've heard there is much in the news about the effect of COVID-19 on the healthcare system and the economy. In your opinion, how will Alzheimer's disease affect the economy and healthcare system in the future?
Well, I think that at this time there has been a significant effect on healthcare systems because patients are not going to hospitals, and we are being sort of we're slowing down the pace of what we are seeing patients, and that has an effect on all the medical centers in the country. But I think that I see the future in a way that medicine and science are going to be part of our lives, and I don't know in which way this is going to go, but will be the population, the public in general, will be more aware of what's going on with medical issues. Is there anything new with the virus? How can we protect it? I'm just only the fact of paying attention to the things that we do on daily basis. That is an effect that medicine has on our lives. So there will be a change. Science and medicine will be part of our lives, and I don't know to what it will be. There is no way that will happen, but I don't know to what extent.
Okay, Dr. Lopez. Second question we get is, how might your research budget be affected by the COVID-19 pandemic?
So far, the research budgets are not being affected, and I would say that, as I mentioned before, that the virus is affecting more older individuals and individuals, especially those with Alzheimer's disease and dementia. So I estimate that there will be an increase in the budget for research to study that, I would say, toxic relationship, which is the virus, aging, and dementia. There are already some proposals coming through the NIH that are oriented in this way, but I would say that the budget will be increased.
Thanks, Dr. Lopez. And finally, so many have asked us, how are you and your family coping during the pandemic?
Well, so far, so good. We are doing okay. I'm an expert on mystery movies now, but we are doing okay. And as you can see, I'm coming to my office every day, and I try to be in touch with my patients.
Good, we're glad to hear that. On behalf of UPMC and the University of Pittsburgh, we thank all of you for your support and encouragement of our faculty and staff's patient care and research efforts. We are all in this together. Please keep an eye out for future videos from Dr. Lopez and his partners. Let us know what you would like to learn more about in the future. Be safe and be well. Thank you.